lot of people will actually have back pain for no real reason as far as an injury or serious condition. Most people just get back pain because of improper techniques when they're trying to lift, the prolonged sitting, the poor posture with carrying stuff, things like that, with the imbalance of muscles. So more and more people are complaining of back pain, and actually even younger people are complaining of back pain. A lot of people have the mentality that I'll just wait and see what happens because they feel like it's going to go away pretty soon. And most of the time, within about 6 weeks, traditional back pain will get better. However, if you notice things that are not getting better within 3 to 4 weeks about that, then you should definitely get it looked at right away. The spine's pretty complicated. The spine is made up of all these vertebrae, all the way from the neck, the mid-back, and the low back. So this is the back of the spine. These are the bony things that stick out in the back of your spine. And then these are your hip bones. And then this is your sacrum right here, and that's where we sit. I call it the sit bone. The first thing is called degenerative disc disease. And that's something that's pretty common as we age. And what happens is here, if you can see, we have these discs in between each vertebrae. So there's a disc between 2 vertebrae all the way from your neck to your low back. And they are our cushioning structures, and they involve making sure that all the weight that is distributed from the top end of the body is distributed evenly to the bottom end of the body. So what happens with degenerative disc disease is that this lovely squishy disc material that's nice and thick starts to thin out. So as this starts to thin out, I mean, we're holding this weight of our body and gravity's coming against us. So as we get older and older and more gravity is pushing down on us, it's just normal for this disc material to thin out. So that's pretty common. And a lot of people have it and don't even realize it. Needless to say, is an x-ray showing degenerative disc disease isn't the end of the world, because most of the time that might not even be the source of your pain. So just a little bit of explanation about this disc stuff here. So I always like to compare it and explain to my patients that it's pretty much like a jelly donut. If you think of a jelly donut, it's nice, soft, cushiony. It's got that jelly in the middle that's like a disc. It's nice, soft, cushiony, and it has a central part called the nucleus, and it's supposed to be pretty thick. And what happens is with that jelly donut is that material just starts to thin out, more kind of like a pancake. So instead of a nice jelly donut cushion there's more of like a thinner pancake. So that just means this bone gets kind of closer to this bone, and that's called degenerative disc disease. And like I said, it's pretty common. Any person that randomly gets an x-ray that might not necessarily be complaining of back pain will most likely be showing some kind of degenerative disc disease. Usually those people are okay at rest. It's more of when they're standing up and walking is when they have pain. Could be just in the back, and then as it progressively gets worse, that pain radiates down into the rear end area and into the legs. Also, numbness and tingling can occur with that as more compression of a nerve occurs. Radiating pain also occurs to one side if it's a disc bulge or a herniation. And like I said before, as the symptoms get worse, you'll find that you get more and more numbness and tingling, as well as weakness in the leg that's involved from whatever side that disc is protruding from. Physical therapy, how can we help you with these problems? We can assess the pain and let you know exactly where it's stemming from, and if your pain that you're having is associated with a significant back issue, we can assess all that. We can give you exercises so that your back muscles aren't doing all the work, but they have a helper system with your core muscles, because it's really important that your core is strong and that you're not relying all on your back for different activities. Also, some hands-on techniques are super important to be doing. We want to work on the soft tissue components, the tissues that are tight on one side that are, versus the other side that are loose. We can also do spinal mobility hands-on techniques so that we can increase your range of motion in your spine, which may help alleviate some of that pain. There are specific ways we can teach you how to lift something so that you do not get injured. And if you've already been injured by a lifting issue, we can explain to you the proper way to do it from there on out so that you do not re-injure or progressively make things worse. And finally, home exercise program, because our goal with physical therapy is to get you back doing what you love to do. So we want to see you, we want to help you. We love it when people come in, but we also want you to be able to know how to manage it and take care of it on your own, so that for some reason, if you start getting symptoms, you have the tools to try to address it. And as always, if you need more help, you can come back. So if you're having some issues with your back or have any questions and you're looking for some help with that, we can see you here at Loudon Sports Therapy Center. All you have to do is click on the link below and schedule an evaluation.